I haven't been going live like I used to, so I don't know if YouTube is now restricting the comment section or what, because I did a live stream like last week, and right away there was like a monkey and a sign that showed that the comment section is not working. And then I did it right now and the same thing. So I guess I don't know what's going on. Trying to study, but these days I haven't been in the mood to study. So like, let me just go live and listen to my lecture video. Let's study together.
Reports to Air is Human. Building a Safer Health System, Institute of Medicine, 2000, and Crossing the Quality Chasm, a New Health System for the 21st Century, Institute of Medicine, 2001, document abundant evidence of serious and extensive quality problems throughout the U.S.
So
Healthcare
when I
system.
try to
Poorly designed care
type out, it
processes or
says
systems have led to unnecessary
youtube.com
duplication of
refused to
services,
connect.
long waiting times and delays, and compromised patient safety, resulting in avoidable errors and harm to patients. Schuster et al., 1998. In addition to an unacceptable number of errors, the healthcare system is plagued by waste and inefficiency. Waste involves the use of resources without benefit to patients, extra and useless tests, multiple entries of such things as physicians' prescriptions and laboratory orders, classifications that add complexity without adding value, such as types of appointments and job classifications, and multiple layers of control, such as approvals. Inefficiency is apparent in the long waits patients must endure for both services and test results. Such waiting can result in a delay in diagnosis or treatment that leads to preventable complications. Institute of Medicine, 2001. Healthcare organizations are increasingly adopting methods and techniques that originated in various industrial movements, such as total quality management and continuous quality improvement, to minimize waste, decrease errors, increase efficiency, and ultimately improve quality of care. Most commonly termed quality improvement in healthcare, these approaches require that health professionals be clear about what they are trying to accomplish, what changes they can make that will result in an improvement, and how they will know that the improvement has occurred. Barrick, 1996. More specifically, healthcare professionals need to be educated to do the following. Barrick et al., 1992, Donabadian, 1980, Halpern et al., 2001, Institute of Medicine, 2001, Schuster et al., 1998. Continually understand and measure quality of care in terms of structure, or the inputs into the system, such as patients, staff, and environments, process, or the interactions between clinicians and patients, and outcomes, or evidence about changes in patients' health status in relation to patient and community needs. Assess current practices and compare them with relevant better practices elsewhere as a means of identifying opportunities for improvement. Design and test interventions to change the process of care, with the objective of improving quality. Identify errors and hazards in care, understand and implement basic safety design principles, such as standardization and simplification and human factors training. Both act as an effective member of an interdisciplinary team and improve the quality of one's own performance through self-assessment and personal change. A growing body of studies indicates that applying quality improvement methods and principles mitigates errors, waste, inefficiency, and delay. Holman et al., 2001, Keefe et al., 2001, O'Connor et al., 1996. One study found that implementation of a quality improvement program was associated with a high level of adherence to quality of care indicators for acute myocardial infarction. Mehta et al., 2000. Using quality improvement methods, researchers were able to improve medication. 59. Copyright National Academy of Sciences. All rights reserved. Health Professions Education, A Bridge to Quality. Health Professions Education. Management for Depression, Anutzer et al., 2001. and physicians and other health professionals involved in cardiac surgery in northern New England used continuous improvement techniques to reduce their in-hospital mortality rate after coronary artery bypass graft surgery. After 2 years, a 24% reduction in the in-hospital mortality rate was achieved. O'Connor et al., 1996. Box 3-6 presents an example of how interdisciplinary teams can apply quality improvement strategies to reduce
Camera
errors.
is terrible.
Quality improvement emerged from the industrial sector as an effective package of theory and practical tools for reducing errors in the production process. As applied to healthcare, it has been praised by some, but has spread slowly. One notable constraint has been the lack of a supporting information infrastructure. Another has been an absence of leadership and support and a lack of enthusiasm from and often skepticism among healthcare providers regarding the effectiveness of the approach. Blumenthal and Epstein, 1996, Brennan, 1998, Furley and Shortell, 2001. Such skepticism is understandable, given that the evidence for the effectiveness of the approach is largely anecdotal. Blumenthal and Kilo, 1998, and the rigor of much of the evidence available is questionable. Shortell et al., 1998. Regardless of the barriers outlined above, the committee believes that the question is not whether health professionals should apply quality improvement approaches, but how they can implement such approaches more successfully within healthcare. One review of the studies to date suggests that quality improvement approaches should be better adapted to the realities of healthcare and be more related to the needs of clinicians and to patient-related problems. Grull, 2001. Summit participants advocated that the healthcare system build on the experience of groups in other industries that have been able to demonstrate gains in quality through the use of quality improvement methods. Utilize informatics. Healthcare informatics is more than information technology. It is the development and application of information technology systems to problems in healthcare, research, and education. Mazes et al., 2000. Informatics. Box 3-6. Working in teams to reduce errors. Luther Middelfort Hospital in Eau Claire, Wisconsin, is a 300-bed facility, part of the Mayo Health System. An interdisciplinary team of a nurse, a physician, and a pharmacist was formed to examine medical errors in the facility. Data showed that 56% of the hospital's medication errors occurred during admission, in hospital transfers, and at discharge. Armed with this information, the team began applying quality improvement methods to address medication errors occurring during these three interfaces of care. They discovered variations in the use of Coumadin, a blood thinner